Hi, this is Dr. Majid Aslam Malik. I am from Jammu and Kashmir. Now I am been in general dentistry since 5 years.
Hi, I'm Dr. Anjali. I'm from Rajasthan, Ajmer. I've completed my BDS in 2020 and I've been practicing since 4 years now.
Hi, this is Dr. Dhanush. I'm from Karnataka. I finished my BDS in 2023 from Sharavati Dental College.
Hi, this is Dr. Aniket. I'm from Bidar. I've studied in Bangalore.
Hi, I'm Dr. Ishita Singh and I'm from Allahabad, Uttar Pradesh. I have been doing dentistry from 2 years.
Yes, I am Dr. Tangadari Paramasivam from Coimbatore, Tamil Nadu. I have been practicing dentistry for past 3 years.
I am Dr. Aditya Shrestha and I completed my BDS in the year 2023 from Bangalore.
So some of my friends from my college have done some courses here. So that is how I got to know about AIAD. And for particularly Implant, I have searched and this is the institute where I find that they were providing maximum cases.
I searched lots of courses regarding the oral implantology on the internet. So I went through many websites. Where did I get the one website that was AIAD, and I searched into it and I found it really good.
For 4 months, they were giving 30 implants, and I was interested in implantology. So I thought it's a better place to join as compared to other places.
Through their online presence and through my friends, many of my seniors have attended FRCD and general dentistry here. So by that I get to know.
I got to know about AIAD while I was scrolling Google, finding for some fellowships and mastership courses.
I got to know about AID from one of my batchmates who stays in Hyderabad.
So I get to know about AID through friends because my friend have done a course here and he gave an excellent review. So I get to know AID through that.
The lectures here are super informative. They are very helpful. The staff here, they help us clear all the doubts. They are very knowledgeable.
Lectures will be precision. I mean, they'll tell the perfect things, what to do and what not to do. Everything will be so precise and it will be applicable in your clinics. So, and everything will be explained. Particularly, even if it's a silly thing and it's a proper thing, everything will be explained. So, lectures are good.
Lectures are so good and it is more informative. I haven't known that this much informative and I got more knowledge through the lectures.
Very brilliant, very meaningful. It's like their whole experience they have shared with us.
It was very good. It was very helpful. Like they were very informative. I got to learn a lot from here, from the lectures and everything. So it was overall a very good experience for me.
The lectures were very informative. They have summarized almost everything.
The lectures are really good. Prosthetic lectures as well as surgical lectures were really good and really advanced actually. Mentors here are one of the experienced oral implantologists here in the country. Amul Thorat sir and Sunil sir is having the experience of the more than 20 years.
The mentors, they are like our friends and you can ask anything. Like you can go approach them every time. Like you can even you can send messages and ask questions if you have any doubt after the cases, even after the clinical hours.
Mentors were very helpful. Like literally you can go them for almost anything and everything. They come with a very helping nature and they're always ready to help. No matter like you ask them something good, something great or something very silly, they're always there to help.
They were very good and it was very informative. Like whatever we want, we can ask them. It's not like some college staff that we have to be, they are strict and all. They are very friendly.
The mentors were actually very experienced and friendly, and they are very easily approachable. You can go to them with any doubts anytime.
The mentors here are very cooperative, very knowledgeable. They are a great team. They help us motivate, and because of them, I have been a little confident about my work now.
Mentors were excellent and they are easily approachable, and there are so many times I had doubts and I'll pile up with so many doubts and I have came with a note and they have explained me everything, calm way. They explain everything.
The clinical exposure here is way too good. It is much better than any other place because here we get a good observation and then we learn to practically apply.
Clinical exposure was good. Got to do a lot of cases as well as see different kinds of cases.
It was good and I got to perform most of the every cases and clinical experiences overall it's so good. Yeah, fine.
Oh, it's very nice. I got to do because also one of the major reason that here we get many patients. Like the patient flow is very good, so that is one of the major reason why you are exposed to patients of various kinds. So for that, my clinical exposure was very good because I was exposed to patients of various kinds. So yeah, it was good.
Actually, I was first surprised when I went to the website of the AIAD. It was lots of things there were being mentioned, like about the patients, about the cases, about the different scenarios, about the treatment planning, about the CBCT sessions. But once I got here, my all the confusions were vanished because the what they promise on the website, this was actually happening here.
It was good. Within 3 months, we'll get around 30 cases, and the patient numbers are good. And we need there is no necessary thing that we have to go out and ask people to get their implant done. The clinic itself, they give us cases, like they'll make sure that we'll get 30 cases within 4 months. So
In fact, too good that we can see n number of cases here and very informative cases and very advanced cases also. I have placed 25 plus implants here.
For now, I have placed 27 implants.
I placed more than 30 implants.
I've placed 25 implants up till now.
I have placed 30 implants.
I have placed 27 implants till today.
I have placed more than 30 implants. Interior implant placements in the aesthetic zone, implant placements in the posterior zone, direct sinus lifts as well as indirect sinus lifts I have done, pterygoid I have done. So it is a comprehensive course that will deliver you the much you can expect.
I have done direct sinus lift, indirect sinus lift, and I've seen good cases like now lateralization, GBR, everything. Like it's a perfect place. It's a package. You'll get everything in 3 months.
So I have performed the guided bone regeneration, which is GBR. Have placed indirect sinus lift, have done direct sinus lift, and have placed a pterygoid implant and got to assist the zygomatic implants and the nerve lateralization procedure also. Yeah.
I have done indirect sinus lifts, direct sinus lifts, pterygoid implants, and conventional implants.
Indirect sinus lift, guided bone generation, and many normal cases also.
I have done immediate implant cases, then GBR cases, indirect sinus lift, ridge split case, then socket shield, and other cases also.
I have done GBR guided bone regeneration cases, direct sinus lift, indirect sinus lift, socket shield technique, and pterygoid implants too. I have performed a socket shield technique where like I can send the patient. We have restored with the immediate restoration also. It's like patient came without teeth and went out with teeth. It actually an interesting case, and patient went out with smile.
It will be indirect sinus lift. It looked very easy in the beginning, but turned out very difficult to place. So each and every case is an experience, and each and every case is a special.
So I've done one indirect sinus lift, which I initially thought will be like every other case. But then while doing it, I faced some difficulties and got to learn a lot from it. Any simple case can also be interesting.
I assisted here at Kiran sir a case that is known as nerve lateralization. Nerve lateralization is like a very comprehensive procedure, and this is happening in AIAD only.
Yeah, nerve lateralization is a interesting case which I have seen. It's actually a good case.
I found the ridge split case the most interesting.
I have done one indirect sinus lift case. It was interesting because these guys already did direct sinus lift in that case earlier, but then the bone was not good as we needed, so we performed an indirect sinus lift case and then placed the implant. So it was a very good experience for me.